Oh, she's calling me. Hi. I bet it's not working for her. All right, you guys ready?
Mhm.
Hi, this is Sally Flashberger from the Board for People with Developmental Disabilities. I'm the Living Well grant manager, and we're here today for our Living Well Wednesdays. We are here today to talk about what the new normal looks like and how people can return safely to the community and to work and just keeping yourself safe throughout the what is our new normal. Today we have Christy with us. She's one of our self-advocates on the grant, and Caitlin and Shannon, as we have every week. And we are trying to connect Cindy Bentley, but we're having some issues, so we may not be able to get her on the line today. Once I get going, I'll try to get her on and see if we can connect through her phone. That's probably the best way. Channing, you want to switch the slide? All right, so we are in a new space right now where the Safer at Home order has ended, and that was when the Supreme Court decided that it could no longer be in place, and that ended on May 13th. And so now it's really up to cities, towns, and counties to decide if they're going to put their own orders in place. And so some still have orders. We know that Milwaukee at the present time still has an order. Some cities may have limited orders, but I think that's what makes it really confusing is people really need to be checking with their own cities and counties to see what is happening. And I think the biggest thing we want you to remember is that now you really have to be in charge of yourself and figuring out what's happening in your community and how you're going to keep yourself safe during this time. Next slide. So we wanted to kind of give you some ideas of places around the state that you could figure out what is happening in your community. So as I said, each city, town, or county is going to be making their own decisions. And one of the best places that you can start is by contacting your county public health department. There's a link here to that. And it's really simple. I just Googled public health counties and the DHS, the Department of Health Services list came up. And it lets you click on your county and then you can get the number to contact them. But we have counties and then we also have cities and towns. And so some cities may be also coming up with their own plans. So that would be another place to contact is your city health department. What I have seen on many of the county pages is that they do have a COVID-related web page on their county site. And so it gives you lots of good information there. It talks about, you know, what are the numbers in your county, what orders there might be, ways to keep yourself safe. So there is a lot of information out there on the county websites. but you still want to be following those CDC guidelines, and we've linked that here also. But those guidelines are what we've been talking about all along, where you're social distancing, you're wearing masks, you're doing good hand washing. So there's lots of preventative ways to stay safe from the virus, and you should still be following those. Another portion would be that the CDC has guidelines for in the community. So these are if you're going out into the community, if you're going into businesses and those types of areas, how you can stay safe while you are going out and around. So just lots of important resources for you to look at as a person before you decide to venture out into the world now in our new normal. So we also know that businesses are opening and trying to keep people safe. Um, there are lots of different ways to get information on businesses. You can call ahead to local businesses, find out what safety precautions they are taking. We've heard about lots of businesses limiting the number of people who might go in to shop. If it's a restaurant, maybe they're only having 25% of the people eating. There may be, we saw some considerations of small businesses where they were only letting 5 people in at a time. But again, keeping that social distancing, wearing a mask, washing your hands. And I think the other thing that we've talked about in our own house is if we eventually decide we're going to go someplace in public and we get there and it's crowded, there's no way that you can keep social distancing, we're just going to leave. And I think that's perfectly normal. We've talked about if we sit down at a table at a restaurant, you say it's outside, and before we know it, it would be crowded. We're probably going to excuse ourselves and say, it's just not safe for us to be there. And so you should always be thinking about your health and safety. That's the most important thing when deciding what you're going to do and what businesses maybe you're going to be frequenting.
Oh, Sally, I realize I accidentally split up your slide, so I'm going to
That's okay.
fast forward
Okay.
here.
So
going up. No, I don't want to do that. Hold on.
So there is another slide that talks about what the different plans are. So what the state has done is they have developed different plans for different types of businesses. And they're in the PowerPoint, you'll see there's a link to
Hello?
Hi, is that Cindy?
Yep. I had a little
right.
difficult, and then I had to use the lady room. Sorry.
All
So
right,
I'm
no
all set
problem.
now.
We're just keeping moving forward, and we haven't even got to the part where we want you to perfect timing, Cindy.
Okay, that sounds good.
All right.
Okay, thank you so much for being patient. Bye.
All right.
Okay.
So these are the different types of businesses that are listed in the WEDC. So that is a organization that has provided some guidance on ways to keep your ways for businesses to open safely, but it also talks about how you could go to those types of businesses. So anything from entertainment, movie theaters, fitness centers, hair salons, even outdoor gatherings, public places, lots of good information and very detailed information. And so what I would say is look at these recommendations. If you are thinking about going out in public and going to one of these places, call first. Maybe ask them, are they following these types of guidelines? If you go there, do you see some of the things that they're suggesting? So lots of the recommendations are that people in the businesses are wearing masks, they're able to social distance, they're cleaning quite frequently, but lots of good ideas there for you to kind of be thinking about what those things look like. So for instance, restaurants may now be using disposable plates and silverware. Retail stores are doing deep cleaning after they close. Some are only letting a small amount of people in. But again, this is just information that you should have. And again, if there's no order, they call it, you know, if there's no particular order for that city or that county, then really it's kind of like, what should businesses be doing to keep people safe? And if you go to a business that, you know, maybe isn't following the same things that you think is important, again, then you have a right to keep yourself safe and maybe find a different place to go out for the day. I'll give you a great example. My son and I, they have now opened these outdoor theaters, and so we went to an outdoor theater to see a movie over the weekend, and we stayed in our car. They said people could get out of their cars, but the cars were parked very closely, and I was not comfortable with us sitting outside the car in a chair. But they were doing their best to keep people safe, and I really felt that it was a pretty safe situation, and we stayed in the car. But again, that was a choice that we made. There were lots of people sitting outside their cars, but we stayed in our car to stay safe. So it's really just about you using your own judgment how to keep yourself safe. All right, I think I'm turning it over to Shannon and Christy and Cindy. So Shannon's gonna walk us through the next part.
Yeah, I mean, first, you know, let's hear from Christy, if you don't mind, and ask her, what she's thinking about is what her return to the new normal might look like. Christy, what are you thinking about doing now that things are starting to open up again?
I just went to my first public outing last night, and it was at the YMCA in town. They were very clean and diligently working on keeping things safe, and I felt really comfortable there.
Yeah, was there like less people there? Like, what kind of outing was it?
It was a fitness class, so they had everybody spaced 6 feet apart. Yeah, making sure everything was clean, and yeah. I haven't returned to work yet.
You haven't returned to work yet? Are you making plans for that?
I don't know when we'll be returning.
Okay.
Probably sometime at the earliest, sometime next month.
Okay. So what about being safe with caregivers? Have you made any changes when you have people coming in to help you in your home?
They are diligently washing their hands. I have protective equipment if I decide that I want them to wear it, or if they decide they want to. Yeah, we have a lot of precautions in place.
Okay. Do you wear masks then? Does the staff wear masks?
Currently, no.
Okay. So what about other services? Do you plan to start up any other services? I think you used to go to some day-related services, things like that. Do you plan to do that soon?
Hopefully. I haven't heard anything about those starting up. and I don't know the taxi system, how they're running, because I've heard
Yeah,
there's changes to that, and that's my main source of transportation.
the taxi has been?
Hmm.
Okay. So it sounds like, at some point you'll explore what the transportation service is doing to keep people safe, and then, maybe go back to some of the services that you used to receive.
Definitely. Yeah, I'm hoping to.
Yeah. Do you have any other outings or activities planned that you plan to see or do?
Not right now. Hoping that this will all end by September so I can get into project search.
Ah, okay, great. Yeah. And then what about your social circle? Are you starting to see or thinking about seeing more people, friends, family that you haven't seen in the last 2 months?
Um, I've tried to get in contact with some friends, and it kind of just depends on how comfortable they are. And um, yeah, I haven't really seen anybody except my mom and my caregivers.
Okay. So still keeping that circle small.
Hmm.
Okay, great. Well, thanks.
Yeah.
Appreciate it. Yeah. And Cindy, you're on the line?
Yes, I am.
All right. What about, what kinds of things are you thinking about, doing as businesses in different places in the community start to open up?
Well, I'm a little worried about not eating at a restaurant until. I guess if I'm interested in anything, getting back in my sports and Special Olympics, and I know Monday, the JCC are called, and JCC will be back open on Monday. So I'm not sure I'm ready to do that, but my caregiver and me, she said we should work out. I don't know. I'm not getting in anybody's swimming pool, that's for sure. I'm a little worried about the whole thing. I always wear my mask and stuff like that, and gloves. I was told I should wear gloves because of my condition. I think Special Olympics, seeing my friends again. I haven't really seen any of my friends. I just talked to them on the phone, but that's not the same as hanging out in my living room or backyard or going to their houses and, stuff like that.
Yeah. So the JCC,
I feel a little isolated. I mean, I know I'm a social person, but it's just I feel so isolated. During the week, I'm fine because I'm working and doing a good job, but the weekends is the worstest because I'm usually out going to shopping mall or doing whatever I want. So
yeah.
I might venture into Cole's department store now that it's back open, but I want to call and find out how safe it is before I do that.
Yeah,
I'm
calling
nice.
ahead to see. Yeah.
And getting my haircut and getting a haircut. So I'm going to call that too. Those are the two, I don't know. I just don't know what to tell you. My friends feel isolated too.
It sounds like you're thinking about shopping again and getting your hair cut. You're thinking about seeing some more caregivers, doing things with more services, right?
Yeah, I'm supposed to work out with my caregiver at JCC, and I think the Havarine program is going to be back up and running. But I'm not exactly sure about that. I know that the health club in that is I can go there. At least I can go there and say hello to people. At least there's be more people besides no people. I see my work crew. Oh, I see Kate, but I haven't seen Aaron in months, 2.5. It's just hard. be nice to just see some normal other people besides, you know what I mean, in a nice way. And
Yeah.
I don't even know what you guys look like either. I haven't seen you or Sally, so, you know, it's like everything's on the phone. I haven't seen Phil, nobody. So, I mean, over the Zoom thing, I seen you because we had the employment thing, but that's the only time I've actually seen you now. Maybe I think I've seen you a few other times too, but it's hard. It's just so hard. I am just so grateful I don't need care to get me out of bed. I feel for Tracy, and I also was sorry I was late on this other. Milwaukee County is about to open their day services on June 1st. But what that's going to look like MTFI is not going to open back up until the 22nd, and they're having things like, you know, people that can't sit still and that, what are they going to do with them? Because they'll touch stuff and then they can get sick or get somebody else sick. So they're having a lot of concerns with that. And so I mean, thinking for our office is not opening back up till the 22nd, but we're going to have 2 people at a time in the office and 1 person working at home and sterilize every time, and gloves, not gloves, but masks. I think the gloves is overdoing it, but we'll have a mask on and we'll see how, you know, and we'll see how GT Independent is doing what they're doing to be safe, because we have people coming in there to sign their time cards and that for GT Independent. So there'll be all kinds of people in that bill, you know what I mean? They come in the office, so I don't know how that's going to work.
Yeah. Well, let's.
So, you know,
how about we have?
Okay, sorry. I'm sorry.
Oh no, that's okay. How about we have Caitlin show the self-determination video from way back in early March? You know, about, you talked about ways that you know, you could stay safe.
That's right. Oh yeah. Me and Ashley did that, right? I can't see it, but I know what it looks like.
This was before we even had the safe red home orders, right? It was just about ways to stay healthy.
Oh yeah, we did that. Me and Ashley did that with Susan. Yeah.
Yep.
You're right.
So
okay.
Let's take a look at that.
Okay. All right, I can listen to it. I already know what it looks like.
Hi, I'm Ashley.
Hi, I'm Cindy. You're watching the Self-Determination channel.
I'm in Muskego.
I'm in Milwaukee.
Cindy and I were going to meet today to make this video together, but instead we have to video chat because of the coronavirus.
We want to stay healthy. We hope you stay healthy too.
To help you, we are going to share things so you don't get sick. Are you ready, Cindy?
Yes, I am.
Okay, I'll start. Our first tip is to wash your hands often throughout the day. Always wash them after using the bathroom or being in public, like after you go to the store or take a walk.
Use lots of soap and water and wash for at least 20 seconds. If it helps, you can count to 20. And then, of course, you dry them. All right. That's all to it.
Cough or sneeze into your elbow. This will stop germs from going into the air and onto your hands.
And don't share food or drink. Try not to touch your face, especially your eyes, your mouth, and nose. This is how germs get in your body. If you have to touch your face, use a tissue.
Here are some things you can do to keep your hands busy so you don't touch your face.
Tap your knees.
Click a pen.
Use a fidget spinner.
Doodle.
Play with a ball like this. Well, and that what happens if you lose it.
Play a game on your phone, iPad, or computer.
Remember, no handshaking, no hugging, or no fist bump.
Smile. bobos instead. Hope you love those tips. Thanks for watching, and stay safe out there.
What are you doing to stay healthy? Share your tips in the comments below.
So that was made almost 3 months ago, and still has a lot of great information for everyone as we head out into the new normal in the community. It's starting to connect with people. So, you know, even though the orders have been lifted, like Sally said, we want to maintain all the precautions that we had in place during the safe at home order. So social distancing, washing hands, wearing those face coverings or masks, cleaning surfaces with disinfectants, and not sharing any food, drinks, utensils, linens, you know, with anyone. So it is still possible to, you know, start to connect with people, you know, and especially with people that you know have been following precautions. So some things to think about is think about who's closest to you in your circle, who really matters that you want to connect with. And who do you trust that you can ask questions about what they're doing to stay safe? Are they, you know, limiting their own circle, taking precautions, and, you know, not doing anything foolish like going out to, you know, big public gatherings or bars or, you know, places that are more high risk, restaurants, things like that. You know, also think about what precautions you're taking and let them know so that they feel comfortable connecting with you. You know, so have a conversation, find out, you know, think about who you want to connect with, think about if you're high risk or they're high risk, and then have a conversation about what they're doing to stay safe and what you're doing to stay safe and how you're going to keep your circles limited. You know, if someone you want to connect with is not necessarily following good protocols, you may want to tell them, you know, it's just not the right time for us to connect right now. You know, I want to give it some more time if you're not comfortable, or if you're someone who is at high risk. So I believe it was National Public Radio, the public news. They put out an interesting article recently, and the link is here on the second side. So yes, it's National Public Radio, and they talked to some top, you know, epidemiologists, disease prevention people, and found out, you know, what are some of the low risk, medium risk, and high risk activities that people can be considering right now. And the list is actually quite surprising. And, you know, the article, it goes through some of these activities, these summer activities primarily, and, you know, talks about if they're low risk, medium risk, high risk, and then what other variables add into the idea that, you know, that make them more risky. So I was really surprised to see things like a pool or a beach, spending a day at the beach or at a pool, as being an actually low risk activity, as long as you're maintaining social distance. You know, you're using the restroom or facilities minimally, and they're well ventilated, you know, not real crammed with other people, and that you're, you know, using those precautions like, you know, washing your hands, using disinfectant, not touching a lot of surfaces, things like that. So, you know, the things that on the list that they say in this article that are low to medium risk activities are, you know, a backyard get together with one other household. I actually just did that, you know, the other night over the Memorial Day weekend. We got together with our best friends and their son, and we sat very far apart from one another in the backyard, but all got a chance to actually see each other in person and socialize and, you know, have some sodas and beers and enjoy the afternoon together. So, you know, going to the pool or a beach is actually a low risk activity, again, as long as that facility or that place is maintaining protocols around safety, and, you know, not having full occupancy. Some pools, for instance, I know the pool in my at my health club, they have an outdoor pool, and they're actually removing all of the chairs from the pool area. So people can be in the water. There, I guess apparently water, there's very little chance of transmission of the virus in water. So, you know, playing in a pool or at the beach together seems to be okay. If you do use public restrooms, again, they want to be, you want them to be ventilated and large. You want to go to places that keep their restrooms clean. They did warn against any the small kind of gas stations, single stalls, cramped, not well ventilated bathrooms. But as long as it's a clean, large public bathroom, it should be okay. You know, they said that actually just letting a friend come into your home, as long as your home's clean and they maintain precautions, letting them into your home to quickly use your bathroom is okay. You know, not having them hang out in your house necessarily for any period of time, but, you know, if you do have someone in your backyard, it's okay if they, you know, put some hand sanitizer on, have a mask on, go in, use their bathroom, wash their hands, and come back out. So just keep that in mind. They actually said that staying in a hotel or a vacation rental that is well maintained and cleaned between use, and that you may want to consider disinfecting when you walk in, is actually pretty low risk. Camping is low risk. Again, you have to think about facilities and whether or not what the restrooms and things like that are like, but then use precautions. But exercising outdoors is low risk, and shopping at outdoor malls and small shops with very little crowds. Again, as long as those businesses, like Sally was saying, are you know, taking precautions themselves to keep the numbers of people down, to keep people keep the area safe, and maintain barriers or, you know, displays that allow people to distance. But the high risk, you know, more medium to high risk activities that you want to continue to avoid in order to stay safe are outdoor gatherings with 10 or more people or multiple households. Going to church, unfortunately, you know, going to any in-person church services is really a high risk activity right now. Getting a haircut or going to a salon, they do put that in the medium to high risk category. So if you are considering a haircut or going to a salon, definitely make sure you talk to the salon, you know, or your stylist about what precautions they have in place to ensure that that's okay to do. So, and that would include things also like getting your nails done or going, you know, for a massage or a facial or any of that kind of close contact stuff. Eating in restaurants inside is considered a high risk activity. And then of course, going to a bar or a club, even if they are, you know, keeping people socially distant, you know, keeping tables apart. They did warn in that article that oftentimes if alcohol is involved, people get a little sloppy and may not maintain social distance or use precautions. So just want to keep that in mind. But there's the link to the article. I thought it was a really good way to think through what might be safe to do this summer so that you can continue to connect, you know, start to connect with people you love and want to see, because I think we all miss our family, you know, family members and our close friends. And like, you know, Cindy and Christy both said, resuming services is, you know, on their list. You know, Christy's thinking about going back to, you know, some of the services she had before the COVID pandemic, and same with Cindy, you know, going with her caregiver to work out and whatnot. So you're going to want to ask them what precautions they're taking. You're going to want to think if you need some extra support in order to receive services from them, you know, to take the precautions that you follow the new rules they have in place. Another thing you'll want to really consider is, you know, if what they can offer you now, given the limitations on activities and you know, people being in the same area together, doing the same things together, whether or not the activities and things that they're offering really do fit your interests and goals. Because if they don't, if you don't, you know, want to engage in the types of things that they're able to offer over the summer months, then you don't necessarily have to choose them as a service provider. You might want to look into different options. And then, you know, again, asking, you know, like Christy said, you know, really, you know, figuring out the transportation you need and what they're doing to keep people safe and how that might change, because maybe you have to change your mode of transportation or find a different way to get rides to and from your service provider. All right, with that, I'll hand it over to Caitlin to take us through some of the tools and resources that we've created that are still relevant as we go back to the new normal.
All right, great, thank you. I am trying to do both the live and this, so I'm gonna do my best to do both things, and we'll see how it goes. So we are going through the change from staying at home to being able to go back out into the community in small ways. And that might change some other things like going back to work or where we're living. Some people might have moved where they were living during this time and are now returning to a different living situation or finding a new one. And that means that there are still things that some of these tools that we put in place during COVID-19 can still be really useful as we start to make the change. The My Safe at Home plan is now the My Safe Home plan, and that is a tool that we developed that helps you think through what you need in your home for it to be safe. This makes sure that you have everything like food, medicine, things to stay clean, running water, the services that you need, and it just gives you an opportunity to walk through those things and figure out if your home is safe or what more supports you might need in order to make it safe. This is especially good if you have moved to a new place, like I said, or if you're starting a new job or going back to work. If you have new supports that are starting, or you're going back to in-person services when you maybe were doing more virtual services before, or even if you just haven't done it in a while. If it's been a couple of months, this is something that you can do every 6 months, every year, just to check in and make sure that everything in your home is still safe and that you have access to all the places and things that you need in order to live comfortably in your home. So we have this linked on our web page. It is the My Safe Home Plan, and you can download it and fill it out, or you can print it out, and you can ask maybe your care manager or IRS consultant to do it with you, or support or someone you trust, or you certainly can just do it on your own. And that way you have a tool to make sure that where you're living is a safe place. All right, so that's the My Safe Home Plan. We also have the My Health form. This form is still something that is pretty relevant right now. Just because we're able to go out into the community a little bit more doesn't mean that COVID is completely gone. It's still in Wisconsin, and people are still getting COVID, which is why it's important to keep the social distancing practices up and to think really critically about where you're going and who you're spending your time with. So as you make those decisions, it's still also important to prepare for the possibility of getting COVID-19. The My Health form provides you with this nice tip sheet for being prepared. It gives you some things to think about in case, as the risk of COVID still exists. So if you start to feel sick, or before you feel sick, and if you decide you need to go to the hospital, it gives you a list of things to be thinking about so that you can be prepared if you get sick. But we want to remind everybody that most people recover from COVID-19 without needing to go to the hospital. This is just to make sure that if in the rare case that you do need some more medical attention, that you are prepared and you have the forms that you need to get the support at the hospital while you are there. There's also a glossary of the medical words related to COVID. So there are some words that might not be familiar to us, and it helps explain what some of those things are, as well as a health form that you can fill out. It can tell the medical professionals who might be helping you about your needs or preferences or your communication style. And that can be a really useful tool if you need to see a doctor that maybe you haven't seen before, or you need to talk to a new medical professional. So it's called My Health Form, and it is on our website. Again, that link is at the bottom here, but you can visit the Living Well page and you will be able to see it. It's got both the tip sheet, the glossary, and the health form that you can fill out on your own or with somebody who supports you. And that way you can be ready if in case you do end up having COVID-19. And then we also have a couple more documents on our website that we've put together since COVID-19 that we think are still super important even as we start to move back into the community. We have the Your Rights During Coronavirus document. This is a list of rights that you have during coronavirus, and it lists the things that you still have the right to, even though things look a little bit differently while people are dealing with COVID-19. It's important that you look over these rights so that you're aware of them, but it's also good to talk about these rights with your friends and family and the people who support you, because they also need to know that there are still some things that don't change even with coronavirus or COVID-19. There's a lot of things that don't change, and it's important that you can have those conversations with the people who support you. And we also have an employment rights document. This one we've developed because a lot of things changed in employment. A lot of people started working from home or are furloughed or laid off right now. But some people will still have essential jobs, and it's important that we talk about the rights that you have as an employee or somebody who's looking for work. So this document, which is also on our website, has the rights that you have as somebody who is either employed or looking for work. Though coronavirus has made changes, there's still some things that you absolutely have the right to. And it's, again, important to talk with the people who support you or your employer to make the right choices about your work and about the situation with COVID-19 and going back to work safely. All right. Again, all of those things are listed on our website. So if you need to download any of those forms, you can definitely do that on the website.
All right. We did have some technical issues, my fault, but we will get this posted on our Facebook page in full. Caitlin did a great job of hopping in there and figuring out a way to get it up on Facebook. I don't see any questions in the chat. So I think for today, we'll probably just end our Living Well Wednesday, unless there are any questions, but I don't think there are. All right, well, always visit our Living Well page and also take a look at always every Wednesday. Next Wednesday, we're going to be talking with Adult Protective Services and folks from DRW about abuse and neglect, the long-term care ombudsman program, and how those agencies can support you. So thank you very much. We appreciate you being with us today.